Good morning, everyone. Thank you, Robert. So we have all of these wonderful programs that you've seen, but at the end of the day, it's really important that downtown is clean and safe and addresses issues of homelessness and other areas of blight within downtown. So we have a multi-pronged approach to these issues, and it starts with Central Houston's leadership in bringing all of these organizations together to address the system of homelessness. We've got a regular meeting that happens with all of these key players that touch the homeless system. We've got Harris County, we've got obviously the city of Houston and Metro, but we've also got mental health resources. We've got the criminal justice system participating in this group. We've got hospital organizations participating in this group. And so these are all of the organizations that need to work together in order to address the systemic issues that lead to homelessness and try to do something about it. So the coordinated effort is really, really important at the systemic level to have all these organizations working together. One of the ideas that came out of this group is utilizing federal funds that were available through COVID dollars, a $65 million total program that came to the city of Houston through the public funds that were available from the COVID dollars. $39 million was contributed by the city of Houston itself, and Harris County put in $18 million. In addition, privately funded $8 million. And that program had a goal of housing 5,000 individuals over a 2-year program. What it does is it utilizes apartments that are already in the market at market rates. It goes in and takes those private dollars and public dollars and reserves those apartments in advance so that we have places to put people as we move them out of their homelessness situation. So you can see the success of that program was tremendous. Not only did we realize the $5,000 goal, 5,000 person goal of housing these folks, but we've actually gone up to 7,500 in terms of total placements into housing from a homelessness situation. And this is permanent supportive housing where they have access to health care, they have access to mental health counseling resources, and so we're very proud of that program. Some other things that came out of the interagency task force are a couple of facilities that are dedicated to folks with mental health issues. One is called an R3 respite hospital, essentially, where people can go and recover. It also has facilities for jail diversion to keep people out of jail and help them recover. There's also some permanent supportive housing units in the mental health area that have come out of this task force. And also a new paradigm in terms of how to address the encampments and how to clear out and move the folks in encampments all around the city into housing. So those are just some of the ideas that have come out of this. Phase 2 is planning to move forward using the American Rescue Plan Act, again, federal dollars that are coming to Houston to address these issues. $15 million coming from the state of Texas, and then Harris County and the city of Houston are each putting in $40 million to have a total of $95 million. Some of you may have seen the article in the paper about that, how we're moving forward to try and house another 5,000 folks through 2024. The district has committed $500,000 for 2022 toward that project. The downtown Deencampment Strategy, we've been able to clear 4 separate encampment areas that are specific to downtown, and I think there are 17 around the city. So you can see the before and after pictures from 500 Fannin. What they do when they go into these encampments is they give folks notice ahead of time that this is an area that will be closing in terms of an encampment. Then they come back and they give them one-on-one counseling in terms of what's available for them. The housing coordinators are there When they go through and do these encampments, their goal is to get 100% of the folks in the encampment into housing, and they've been pretty successful with it. I think they're at about 96% of the folks that are approached in these encampments that actually accept housing. The others that don't want to accept it have to be relocated somewhere else, and obviously that's their choice where they want to go. But we've been able to clear the 500 Fannin, an area from Maine to San Jacinto, an area off of Allen Parkway, and an area behind the Hamilton. And I think for downtown, that's a total of 134 placements into housing. What HPD does is they come back behind it and they make sure that people do not set up shop again there. And in terms of our multi-pronged approach, there's the systemic development, but we also do direct outreach. The Downtown District contracts through Surge, a well-respected organization in this area, and these folks are dedicated to downtown. We have a full-time outreach specialist that just walks the streets of downtown and connects with these people, finding out who they are, what their situation is, telling them about the different programs that are available to get them into housing. Then the clinical case manager picks it up from there and actually holds their hand in terms of getting all the paperwork together that's needed, getting their IDs, getting their health care that they need, and actually bringing them to the housing. So it's a warm handoff there between the outreach specialist and the clinical case manager. And then a peer specialist we also utilize is somebody that's been in a situation of homelessness and can relate to these folks better in terms of telling their story and letting them know why they should accept the housing. So total budget for the district is about $195,000 for that program. Then we have another case manager that's dedicated just to folks with issues of mental health. They are specially trained in that area. We get them through the Harris Center, and they are out on the street every day in downtown trying to convince these folks to select a path to treatment. That program is about $125,000 paid for by the district. And then, of course, we have a dedicated mental health officer that we contract through the Sheriff's Department. Again, specially trained in how to deal with the homeless and the mentally ill, that assists all the case managers in making sure that their outreach efforts are safe. $107,000 for that. We utilize the public intoxication transport team. It's actually at the sobering center. It's specially trained counselors. There's a medic and a counselor on the van, and those vans are out there circulating within downtown looking for folks that are stumbling, that are intoxicated, that may be a danger to themselves or to others, and they're proactively looking for those folks to try and get them off the street and get them into a recovery situation. At a minimum, they'll pick them up, give them a sandwich, take them to the sobering center, let them sort of recover and get their wits about them. And it definitely saves on people going to the emergency rooms and saves, people actually having to go to jail. So our budget for that is about $125,000. Then, of course, you all are familiar with our downtown public safety guides. We've had this program for many years. We have 38 full-time guides that are on the street from 7 a.m. to 11 p.m. daily. And they're kind of your eyes and ears. They're meant to be a buffer between the general public and some of the folks that may be violating civility ordinances, but they're also there to help people that are visitors to downtown that may be unfamiliar with downtown, give them directions, tell them about metro stops, tell them about all the fun things to do in downtown. Our ambassadors are well-trained and out there on the street. Because of the high volume of folks out there, that is actually a $2 million program from the district. But we feel it's a nice amenity to downtown, and it is, I think, we can show that it's a deterrent to crime. For the folks that need a little higher level of encouragement, we have also contracted with private security. We utilize the SEAL team. There are 2 officers on patrol over 4 shifts. Some of that is by auto, some of that is walking. We do cover heavily the Main Street and the heavy pedestrian corridors. They're out there from 7 a.m. to 3 a.m., so they're there, in the late night traffic. They are trained in de-escalation techniques, but if someone does need to be arrested, they are able to hold them there and wait for on-duty HPD to come take care of the situation. We've had over 3,000 calls for service from SEAL in 2021, and the budget for that is $775,000, borne by the district. We also utilize off-duty HPD officers. 2 to 4 officers are out there at any one time walking the streets, and they can have a higher level of enforcement than even the SEAL team can and act as a liaison to the on-duty. $330,000 is what we spend on that program. Then our other focus, of course, is yes, we're working on the systemic issues. Yes, we've got outreach to the homelessness. Yes, we're supporting public safety and the public safety officers that are out there. But we also want to take care of sanitation and unsightly issues. So 5 days a week, our district team is out there cleaning around the encampments, making sure that the litter and the trash from the feedings and just from accumulation of personal property, making sure to the extent we can that those areas are dealt with. We do go out there with HPD DRT officers, again, to make sure that the law is properly enforced and that we're not, our teams are not in an unsafe position. And this allows us also to pick up abandoned property that is within downtown, get that cleaned up and out of the way. So those encampment cleanups are really important, and we have a budget of $125,000 for that. And last but not least, in the public safety, cleanliness, sanitation area, we do have public toilets that are out there. We actually have several of them scattered around downtown. We do service those 7 days a week, and we have hand washing stations just to make sure that the community that's out there can be as clean and safe as possible. So a budget of $25,000 for that. The reason I want to put in the budget numbers is just, I think, to sort of put a point on it that there are significant funds that are directed to these issues of clean and safe and addressing homelessness. And, we just think it's so important and so important of an aspect related to downtown. We have had a number of years where we have put these programs in place. I think over time we evaluate them, we tweak them, we've added some things, and so we really do try and focus on this area because sometimes you can say none of the other things matter unless these particular things are taken care of.